So the influenza virus is a respiratory virus, and there are a number of respiratory viruses. They all can cause infections involving, runny nose, sore throat, difficulty breathing. The influenza tends to be more severe than just about all of those. And so clinical influenza is a respiratory illness, typically with fever, difficulty breathing, malaise, and sometimes body pains as well. Adults who generally are healthy, who think they are getting the flu, the best thing to do is what you would do for any illness really. Rest, keep hydrated, maybe not go to work if you're feeling unwell. I don't think previously healthy adults generally need to see the doctor unless they're really having difficulty breathing or really can't function. And then, as they would ordinarily, it's time to seek medical opinions. Children, I would pretty much give the same sort of advice. So if you think your child, is not feeling great, has a fever, some sneeze and cough, I don't think they necessarily have to go to the doctor unless you think they're really having difficulty breathing. And for this, I generally suggest for parents of young children to look at their children's chest. And if they really are working hard to breathe, then it's time to take them to see the doctor. Also, if children can't keep liquids down, often children eat less when they're ill, but if they can't drink, they need to see a doctor because dehydration is a real problem for respiratory illness. So for anybody who's worried about the flu, far and away the most important thing to do, as they do every year, is to get the flu vaccination. This is readily available at doctor's offices, pharmacies, free of charge. Just bring your OHIP cards. There's a number of different vaccines. For children who don't like needles, there is a nasal spray vaccine available for those over the age of 2. Very young children, so between the age of 6 months and 2 years, will still need the needle, but all of these are judged to be effective in the Canadian environment, and I would strongly recommend influenza vaccination for everybody. So something I hear a lot is people worry that the flu shot will give them the flu. That cannot happen, right? The needle flu shot is not a live virus, and so it is impossible that can produce a respiratory illness. Now what the flu shot can do, specifically the needle, is that it can definitely give you a sore arm. This is a common side effect and one that people should expect. The nasal flu shot that children can get can cause wheezing, and that is the most side effect. That's why young children or anybody with a history of severe asthma shouldn't get it. But influenza vaccination will not give you the flu.